The nurse cares for a patient with a urinary tract infection, UTI. The patient has an allergy to penicillins. Which of the following medications is contraindicated for this patient's illness? A. Streptomycin. B. Clindamycin. C. Sulfasalazine. D. Ceftriaxone. E. Ciprofloxacin. The answer is D. Ceftriaxone. Patients with allergies to penicillins often have cross-allergies to cephalosporins. Cephalosporins such as ceftriaxone should be avoided by patients with these allergies. Patients with cephalosporin allergies should also avoid penicillins. Streptomycin, ciprofloxacin, clindamycin, and sulfasalazine may all treat UTIs but are not penicillins. The nurse assesses patient medications at a primary care clinic. Which of the following patients with osteoporosis should not be prescribed alendronate? A. A 70-year-old female with chronic kidney disease. B. A 62-year-old female on a low-calorie diet. C. A 65-year-old female who is allergic to iodine. D. A 58-year-old female taking estrogen. E. A 53-year-old female taking captopril. The answer is A. A 70-year-old female with chronic kidney disease. The nurse should identify alendronate as a medication that slows bone loss, and is commonly prescribed to patients with osteoporosis to maintain bone density. The nurse should assess ages and risk factors associated with both osteoporosis and alendronate use. Alendronate is contraindicated in patients who are allergic to it, have esophageal issues such as narrowing or blockages, are unable to sit or stand upright for 30 minutes after taking, or have kidney dysfunction or low blood calcium levels. Therefore, the nurse should question the order of alendronate for the 70-year-old female with chronic kidney disease. The nurse should also recognize that older patients are more likely to experience problems such as contraindications with medications due to polypharmacy, so the age of the 70-year-old female should concern the nurse. Alendronate is not contraindicated in patients who are on low-calorie diets, and it is not contraindicated with estrogen or captopril. The pediatric oncology nurse talks to relatives of a child with leukemia. The patient's uncle wants to donate blood for transfusion. Which of the following donor conditions would preclude him from donating blood? A. A 200 mg dose of ibuprofen 20 hours ago. B. A history of Crohn's disease in remission 3 years. C. A history of hepatitis C, 4 years ago. D. A previous cholecystectomy 2 years ago. E. A diagnosis of diverticulosis 10 years ago. The answer is C. A history of hepatitis C 4 years ago. Blood donors must be healthy and feeling well to donate blood. They must also be free of blood-borne pathogens such as HIV/AIDS and hepatitis B, C, and D. Diverticulosis, Crohn's disease, a previous cholecystectomy, and a dose of ibuprofen the previous day do not preclude this person from donating blood. The nurse reviews medication orders for a patient with acute gastritis. Which of the following medications is contraindicated for this patient? A. Ibuprofen. B. Propranolol. C. Furosemide. D. Calcium supplements. E. Acetaminophen. The answer is A. Ibuprofen. Patients with acute gastritis experience inflammation in the gastric mucosa. They must discontinue use of drugs that may cause gastritis or inflammation, such as NSAIDs like ibuprofen or alcohol consumptions. Calcium gluconate, furosemide, acetaminophen, and propranolol are not associated with acute gastritis and can be taken safely by this patient. Which of the following high tyramine foods should be avoided by individuals taking monoamine oxidase inhibitors, MOIs? A. Aged, smoked, fermented, or pickled foods, pork, chocolate. B. Pumpkin, sesame, and sunflower seeds, brassicas. C. Charred, toasted, or roasted foods, glazes, added sweeteners, and syrups. D. Leafy green vegetables, sweet potatoes, tomatoes. The answer is A. Aged, smoked, fermented, or pickled foods, pork, chocolate. Tyramine is an amino acid that is present in many foods, including fermented, aged, or smoked foods, aged cheese, fish, pork, cold cuts, chocolate, alcohol, yeasty breads, peanuts, and beans. High tyramine intake in patients on MOIs can cause hypertensive crisis due to monoamine oxidase's role in tyramine breakdown. Patients taking which of the following antibiotics should be cautioned against any alcohol consumption? A. Mupirocin. B. Neomycin. C. Penicillin. D. Metronidazole. The answer is D. Metronidazole. Drinking alcohol while taking metronidazole can result in nausea, vomiting, flushing, and tachycardia. This is due to metronidazol's inhibition of acetaldehyde dehydrogenase, the enzyme responsible for acetaldehyde catabolism. Reduced function of acetaldehyde dehydrogenase results in toxic levels of acetaldehyde in the blood. Monoamine oxidase inhibitors, MOIs, should not be combined with foods that contain large amounts of what monoamine? A. Synephrine. B. Tyramine. C. Histamine. D. Epinephrine. The answer is B. Tyramine. Tyramine is normally broken down by monoamine oxidase. Monoamine oxidase inhibitors prevent the breakdown and removal, leading abnormally high tyrosine levels in the body. This can in turn displace the storage and increase release of multiple other catecholamines, including dopamine, epinephrine, and norepinephrine. This increase in free catecholamines can cause a hypertensive crisis. You are the nurse taking care of a patient who is being discharged on warfarin for a pulmonary embolism. Which of the following statements would you most likely give when counseling the patient about warfarin use? A. You can participate in all physical activities, including contact sports, while taking warfarin. B. You have an increased risk of seizures while taking warfarin. C. Your risk of bleeding events is not significantly elevated while taking warfarin. D. Do not consume grapefruit juice when taking warfarin. E. You can discontinue taking aspirin, if you were already taking aspirin, while you are taking warfarin. The answer is D. Do not consume grapefruit juice when taking warfarin. This advice is correct because warfarin is metabolized and inactivated by the cytochrome P450, CYP450, enzyme complex, and grapefruit juice is an inhibitor of CYP450. Therefore, when grapefruit juice is consumed, the efficacy of an activation of drugs, like warfarin, is impaired, which increases the effective level of warfarin circulating in the patient's blood. Consequently, even if the patient is taking the prescribed dose of warfarin, the effect of the drug may be greater than intended if taken with grapefruit juice, which can predispose to dangerous, potentially fatal bleeding effects. Thus, avoiding grapefruit juice while taking warfarin is the most appropriate advice for this patient. The patient's risk of bleeding events is elevated while taking warfarin, even without consuming grapefruit juice, though the benefit of preventing future blood clots and pulmonary emboli outweighs the risk of bleeding. Due to the risk of bleeding events while taking warfarin, it would be inappropriate to advise the patient to continue participating in contact sports. Warfarin is not known to cause an increased risk of seizures. It would be inappropriate to advise a patient to discontinue taking aspirin while on warfarin unless explicitly instructed for a medical reason by his physician. While aspirin is an antiplatelet agent, which can predispose to bleeding, and warfarin is an anticoagulant, which also independently can predispose to bleeding, each medication has a clinical indication in the patient, and therefore it is inappropriate to simply discontinue one medication. You are counseling a new patient about initiating a combined oral contraceptive pill, OCP. You know that certain medications can affect the metabolism of OCPs. Which of the following medications could alter the metabolism of OCPs? A. Ciprofloxacin. B. Docusate. C. Lisinopril. D. Fluoxetine. E. Aspirin. The answer is A. Ciprofloxacin. This choice is correct because the combined oral contraceptive pill, OCP, is metabolized and inactivated by the cytochrome P450, CYP450, enzyme complex, and ciprofloxacin, a fluoroquinolone antibiotic, is an inhibitor of CYP450. Therefore, when ciprofloxacin is taken, the efficacy of an activation of drugs, like OCPs, is impaired, which increases the effective level of OCPs circulating in the patient's blood. Consequently, even if the patient is taking the prescribed dose of OCPs, the effect of the drug may be greater than intended if taken with ciprofloxacin or other drugs that inhibit CYP450, which can make the potential adverse effects of OCPs more likely to occur, or occur with greater severity than if that patient had not taken ciprofloxacin with it. Neither lisinopril, an ACE inhibitor, fluoxetine, an SSRI, docusate, a stool softener, nor aspirin, an anti-inflammatory, antiplatelet agent, appreciably induce or inhibit CYP450, and therefore none of them has an appreciable effect on OCP metabolism. You are the nurse taking care of a patient taking warfarin. Despite taking the prescribed dose regularly, the patient's international normalized ratio, INR, is persistently subtherapeutic. You ask the patient if they take any other medications. The patient is most likely to be taking which of the following medications? A. Cimetidine. B. Gemfibrozil. C. Erythromycin. D. Cnidin. E. St. John's wort. The answer is E. St. John's wort. Warfarin is metabolized by the CYP450 enzyme complex, which is known to be induced and inhibited by a variety of other common medications, supplements, and foods. Since this patient's international normalized ratio, INR, is subtherapeutic, meaning that warfarin is not achieving a great enough effect. This should raise the possibility of increased metabolism of warfarin by CYP450, which means that warfarin will be inactivated more quickly than usual. The only agent listed that is known to induce or activate CYP450, which would speed the inactivation of warfarin, is St. John's wort, an herb commonly used for antidepressant activity and anti-inflammatory activity. Gamfibrozil, quinidin, cimetidine, and erythromycin all are inhibitors of CYP450, not inducers, and therefore would slow the metabolism of warfarin, increasing the effective circulating dose of warfarin, which would raise the INR. Therefore, these are not correct answer choices for this case. You are the nurse taking care of a patient being treated with metronidazole for a lower gastrointestinal infection. Which of the following instructions should you give the patient? A. Do not eat spinach when taking this medication. B. Do not consume alcohol while taking this medication. C. Lie flat for 30 minutes after taking this medication. D. Do not take your cholesterol medication when taking this medication. E. Avoid operating heavy machinery while taking this medication. The answer is B. Do not consume alcohol while taking this medication. In this question, what is really being tested is your knowledge of side effects, interactions with metronidazole. One of the major interactions to be aware of with metronidazole is that it can cause an unpleasant interaction when consumed with alcohol that is very similar to the symptoms that occur when one consumes alcohol while taking the alcohol deterrent, antabuse. This reaction includes severe abdominal pain, cramping, nausea, vomiting, facial flushing, and headaches. Patients should avoid drinking alcohol while taking metronidazole and for 3 days after completing their course. Eating spinach, lying flat for 30 minutes after taking metronidazole, taking cholesterol medication while taking metronidazole, and operating heavy machinery while taking metronidazole are inappropriate recommendations, as there are no known direct associations between metronidazole and spinach consumption, head elevation, cholesterol medications, or level of consciousness. What is the most common vitamin deficiency seen in patients taking metformin? A. B6. B. K2. C. D. B12. The answer is D. B12. B12 deficiency is common in patients on metformin, and should be monitored and supplemented either sublingually or intramuscularly. A male client is receiving 150 mg of gentamicin every 8 hours for a soft tissue infection. The nurse giving this medication is aware there are several serious side effects associated with gentamicin, including ototoxicity. Which statement by the client indicates that he may be experiencing this serious side effect? A. I am feeling nauseous. B. I have a metallic taste in my mouth. C. There is a severe rash on my neck and chest. D. I have a high-pitched ringing sound in my ear. E. I am having difficulty swallowing. The answer is D. I have a high-pitched ringing sound in my ear. The ringing in the ear is tinnitus, which is indicative of ototoxicity. Nausea, metallic taste in mouth, difficulty swallowing and skin reactions are not associated with the development of ototoxicity. Which of the following is the most serious potential adverse effect of enalapril? A. Low blood pressure. B. Angioedema. C. Dry cough. D. Nausea and vomiting. The answer is B. Angioedema. All of these are potential side effects of ACE, angiotensin-converting enzyme, inhibitors such as enalapril, but angioedema, the swelling of the face, lips, and/or tongue, is a potentially life-threatening condition, as swelling can obstruct the airway. Which of the following is a symptom of digoxin toxicity? A. Rash. B. Mood swings. C. Tremor. D. Nausea, vomiting, and diarrhea. The answer is D. Nausea, vomiting, and diarrhea. Nausea, vomiting, and diarrhea are common symptoms of digoxin toxicity. Other symptoms may include confusion, anorexia, irregular heartbeat, and palpitations. Tremors, mood swings, and rash are not generally seen with digoxin toxicity. A 19-year-old client presents to the emergency department explaining that he has a history of sickle cell anemia. He is complaining of severe pain in his arms and legs. The nurse recognizes that the patient is experiencing a sickle cell crisis, and is going to administer pain medication as ordered. The nurse is aware that which of the following pain medications is contraindicated for this disorder? A. Morphine. B. Hydromorphone. C. Ibuprofen. D. Fentanyl. E. Mepridine. The answer is E. Mepridine. Mepridine is contraindicated because in high doses it can form a toxic metabolite that can lead to seizures. All other drugs listed are appropriate for pain control for sickle cell crisis. Which of the following best describes extrapyramidal side effects? A. Nausea and vomiting, diminished consciousness, disorientation. B. Altered color vision, altered taste sensation. C. Cutaneous flushing, hypertensive crisis, tachycardia, sweating. D. Dystonia, tremor, slurred speech, restlessness and anxiety. The answer is A. Dystonia, tremor, slurred speech, restlessness and anxiety. Extrapyramidal side effects generally present as slow or repetitive motions or postures, dystonia, spasm, tremor, slurred speech, slowed thought process, restlessness and anxiety, paranoia, and general overall distress. These effects are caused by antipsychotic drugs that act as dopamine D2 receptor antagonists. Which of the following drugs would be least likely to cause extrapyramidal side effects? A. Bupropion. B. Haloperidol. C. Alprazolam. M. D. Fluoxetine. The answer is C. Alprazolam. M. Extrapyramidal side effects are common with typical antipsychotic drugs that act as dopamine D2 receptor antagonists. These include many selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, and norepinephrine dopamine reuptake inhibitors, NDRIs, as well as antiemetics such as metclopramide. Alprazolam is a benzodiazepine and is not associated with extrapyramidal adverse effects. Which of the following medications is associated with increased risk of SIADH, syndrome of inappropriate antidiuretic hormone secretion. A. Drospirenone. B. Chloropropamide. C. Azapoxalone. D. Metronidazole. The answer is B. Chloropropamide. Chloropropamide, an antidiabetic medication in the sulfonylurea class, has been associated with drug-induced SIADH, syndrome of inappropriate antidiuretic hormone secretion. This is a rare but serious complication that will generally resolve once drug treatment has stopped. None of the other drugs listed are associated with this side effect. Which of the following medications can cause the benign side effect of causing an orange-red tint to urine and tears? A. Metronidazole. B. Clindamycin. C. Rifampicin. D. Vancomycin. The answer is C. Rifampicin. Of the drugs listed, the only one associated with this bizarre side effect is rifampicin, a broad-spectrum antibiotic used in tuberculosis. Urine, sweat, saliva, or tears may be turned any shade from red to reddish-orange. Which of the following antibiotics is potentially ototoxic and may cause irreversible hearing loss? A. Gentamicin. B. Penicillin. C. Doxycycline. D. Erythromycin. The answer is A. Gentamicin. Gentamicin is an aminoglycoside antibiotic. Most antibiotics in the aminoglycoside class can have significant ototoxic effects. Of these, streptomycin and gentamicin are primarily toxic to the vestibular system, while amikacin, neomycin, dihydrostreptomycin, and kanamycin primarily affect the cochlea. None of the other antibiotics listed are generally associated with ototoxicity. A 24-year-old female presents with a simple urinary tract infection, for which she is prescribed ciprofloxacin. What is the most severe potential side effect of this medication? A. Tendon injury or rupture, especially Achilles tendon. B. Kidney failure. C. Hepatotoxicity. D. Seizures. The answer is A. Tendon injury or rupture, especially Achilles tendon. Ciprofloxacin has been associated with several cases of tendon injury and rupture, with the typical rupture occurring in the Achilles tendon. Other less severe side effects can include nausea and vomiting, headache, insomnia, and increased sensitivity to caffeine. The other symptoms listed are not generally associated with ciprofloxacin use. Which of the following antibiotics is strictly contraindicated in pregnancy, in lactating mothers, or in children under 8 years old, due to risk of irreversible teeth staining? A. Tetracycline. B. Ceftazidime. C. Rifaximin. D. Clindamycin. The answer is A. Tetracycline. Tetracycline antibiotics are strictly contraindicated in pregnancy, in lactating mothers, or in children under 8 years old, due to risk of irreversible teeth staining. The discoloration occurs only in adult teeth that have not broken the gum line, so adults are not at risk. A 42-year-old man with a history of severe depression who is currently prescribed multiple antidepressants presents with tachycardia, hyperreflexia, sweating, mydriasis, myoclonus. He is confused and mildly agitated. On questioning, he admits that he may have taken one too many of one or more of his medications. What is the most likely cause of his symptoms? A. Hypertensive crisis. B. Serotonin syndrome. C. Extrapyramidal side effects. D. Tardive dyskinesia. The answer is B. Serotonin syndrome. The symptoms this patient are presenting with are consistent with serotonin syndrome, a rapid onset and potentially life-threatening condition of excess circulating serotonin. Symptoms can range from mild to severe, and may include tachycardia, nausea and vomiting, diarrhea, hyperreflexia, sweating, mydriasis, myoclonus, mental status changes, headache, and coma. Serotonin syndrome is generally caused by drug interaction or overdose of drugs that raise circulating serotonin levels, such as selective serotonin reuptake inhibitors, SSRIs, and monoamine oxidase inhibitors, MOIs. A 63-year-old female presents with involuntary grimacing, lip smacking, excessive blinking, and sticking out of the tongue. She also flicks her fingers and her wrists. She states that she has no control over these movements, and that they have gotten progressively worse over the last 3 years. Her family is worried that she may be experiencing an early form of dementia. Her medical history is significant for depression, for which she has been taking aripiprazole for the last 9 years. Which of the following is the most likely cause of her symptoms? A. Early onset Alzheimer's disease. B. Worsening depression. C. Tardive dyskinesia. D. Serotonin syndrome. The answer is C. Tardive dyskinesia. The most likely cause of uncontrollable muscle movements in the absence of other systemic symptoms in a patient with a history of antipsychotic drug use is tardive dyskinesia. This is a disorder of rapid involuntary movements, most often in the face or head but also potentially affecting the extremities. Its exact cause is not well understood, but it is theorized to be an issue of sensitization of the D2 dopamine receptors after long-term neuroleptic use. Which of the following is not a common side effects in individuals using selective serotonin reuptake inhibitors, SSRIs? A. Increased risk of bone fracture. B. Low libido. C. Increased risk of suicide in children and adolescents. D. Coronary heart disease. The answer is D. Coronary heart disease. While SSRIs have been known to cause a variety of adverse effects, including diminished libido, increased risk of suicide in children and adolescents, restlessness, photosensitivity, and increased risk of bone fracture, individuals taking SSRIs are not associated with any increased incidence of coronary heart disease. Which of the following over-the-counter medications has been associated with hepatotoxicity and liver failure? A. Cetirizine. B. Diphenhydramine. C. Acetaminophen. D. Acetyl salicylic acid. The answer is C. Acetaminophen. Acetaminophen has surpassed viral hepatitis as the most common cause of acute hepatic failure in the United States. Hepatotoxicity can occur in doses of 7.5 grams or up for adults and 150 milligrams per kg of body weight in children aged 1 to 6. None of the other drugs listed are particularly hepatotoxic. What is the mechanism of cytotoxicity in acetaminophen-related liver failure? A. Depletion of gliadothin. B. Blockage of bile canaliculi. C. Fibrosis of hepatocytes. D. Formation of fatty infiltrates. The answer is D. Depletion of glutathione. Acetaminophen depletes glutathione, one of the body's most important antioxidants. The liver is the body's main processing organ for environmental and ingested toxins, and glutathione is the primary molecule the liver uses to rid itself of the harmful byproducts of the detoxification process. When glutathione is severely depleted, such as with acetaminophen overdose, hepatic cells can rapidly necrose, resulting in liver failure and even death. An individual taking which of the following medications must be instructed to remain upright for a minimum of 30 minutes after ingestion in order to avoid esophagitis? A. Alendronate. B. Finasteride. C. Paclitaxel. D. Phalodipine. The answer is A. Alendronate. Alendronate is a bisphosphonate drug used in the treatment of osteoporosis and osteogenesis imperfecta. An individual taking this medication should be instructed to remain upright for a minimum of 30 minutes after ingestion in order to avoid esophagitis. Other gastrointestinal adverse effects of alendronate include esophageal strictures, achalasia, gastric ulcers, and gastritis. None of the other medications listed are associated with esophagitis. Which of the following is not a side effect associated with beta blockers? A. Dizziness. B. Fatigue. C. Weakness. D. All of these are side effects of beta blockers. The answer is D. All of these are side effects of beta blockers. The most common side effects of beta blockers are fatigue, dizziness, weakness, cold hands or feet, dry mouth, headache, nausea, diarrhea, and shortness of breath. Death by opiate overdose is generally the result of A. Respiratory depression. B. Myocardial infarction. C. Liver failure. D. Serotonin syndrome. The answer is A. Respiratory depression. The answer is A. Respiratory depression. Most opiates can cause respiratory depression when taken in toxic levels. They do this by reducing the sensitivity of respiratory center neurons to carbon dioxide, which results in decreased breathing. In more moderate cases, brain damage can precede death due to CNS hypoxia. Opiates generally are not associated with liver failure, unless taken as a combination drug with acetaminophen, such as hydrocodone, heart attack, or serotonin syndrome. A nurse is working with a 36-year-old patient comes in for a back injury after a motor vehicle accident. He is prescribed acetaminophen for pain relief. 3 days later he calls the nurse to complain that he is experiencing itching all over. He is concerned that he might be having an allergic reaction to the pain medication. There is no rash associated with his pruritus. He has no hives, no nausea or vomiting, no shortness of breath, no swelling of the mouth or face. What is the most likely cause of his itching? A. Opiate-triggered histamine release. B. Dermatitis due to opiate allergy. C. Kidney failure. D. All of these are likely causes. The answer is A. Opiate-triggered histamine release. Many opiates stimulate histamine release by mast cells. The cause of this stimulation remains unclear, but it is considered to be a non-immunological, therefore, not an allergy. There is some speculation that opiates trigger the release of histamine from mast cells by directly activating G proteins on mast cell surfaces. Opiates are not generally associated with kidney failure, and the most common symptoms in opiate allergy include hives, flushing, hives, low blood pressure, gastrointestinal discomfort, though constipation is typical in most patients and does not indicate allergic reaction, and angioedema. Which of the following is a common side effect of nonsteroidal anti-inflammatory, NSAID, use? A. Weight gain. B. Gastritis. C. Hypertension. D. Muscle spasms. The answer is B. Gastritis. NSAIDs are frequently associated with irritation of the gastric mucosa. This can lead to gastritis, ulcer formation, gastric bleeding, or perforation. NSAID use is not generally associated with weight gain, loss of bone density, muscle spasms, or hypertension. You are assessing a 23-year-old female who presents for follow-up after being started on oral iron sulfate 1 month ago for iron deficiency anemia. In the last month she was also started on azithromycin for a respiratory infection, and has been taking ibuprofen for back pain. She now complains of 3 weeks of constipation. She tells you that her diet consists of many green, leafy vegetables, red meat, and greasy, fatty foods. Which of the following is the most likely cause of her constipation? A. Ibuprofen. B. Green, leafy vegetable consumption. C. Azithromycin. D. Iron sulfate. The answer is D. Iron sulfate. The most likely cause of this patient's constipation is the oral iron sulfate that she is taking. Constipation is a very common side effect of oral iron therapy, and for that reason, iron therapy is often given concurrently with a stool softener to relieve constipation. The other medications taken, azithromycin, and ibuprofen, each commonly cause some degree of gastrointestinal upset, including but not limited to abdominal pain and diarrhea, but not constipation. Dietarily, the consumption of green, leafy vegetables is associated with looser, more regular bowel movements, as opposed to constipation. The consumption of greasy, fatty foods is also associated with looser bowel movements, rather than constipation, making it unlikely that her diet is the cause of her constipation. You are the nurse taking care of a patient with a history of schizophrenia, not on any medications, who is being admitted for disorganized thoughts, paranoid delusions, auditory hallucinations, and combative behavior. The physician orders a dose of haloperidol to be administered. Prior to giving the haloperidol, you suggest that which of the following be done? A. Obtain a CT abdomen. B. Obtain a blood glucose level. C. Obtain a chest X-ray. D. Obtain an electrocardiogram, ECG. E. Contact the authorities to detain the patient since he or she is being combative. The answer is D. Obtain an electrocardiogram, ECG. Haloperidol has the potential to prolong the QT interval on an ECG. QT prolongation can be particularly dangerous in patients who already have a prolonged QT interval due to a pre-existing medical condition, for example long QT syndrome, or medications they are already taking. A prolonged QT interval has the potential to progress on ECG to more dangerous arrhythmias including torsades de pointes and ventricular fibrillation or tachycardia, which can be fatal. Therefore, it is imperative to check a patient's QT interval on an ECG prior to administering haloperidol to confirm that they do not already have a prolonged QT interval. While this patient's blood glucose is not necessarily going to be normal, that is not something that needs to be emergently checked prior to haloperidol administration. There is no indication to obtain a chest X-ray or CT abdomen prior to haloperidol administration. It would be inappropriate to contact the authorities to detain this acutely psychotic patient with schizophrenia, as the patient is already in the hospital and in the care of a psychiatric medical team. Further, even though the patient is combative, if necessary, the medical team is allowed to place the patient in restraints without the need for police intervention. There is no evidence that any members of the care team are in acute danger. A physician orders Viagra, sildenafil, for a patient to treat erectile dysfunction. The patient currently takes fish oil, nitrates for chest pain, prednisone for lupus, and aspirin and simvastatin for vascular disease. Sildenafil is contraindicated in this patient because he takes which medication? A. Aspirin. B. Fish oil. C. Simvastatin. D. Prednisone. E. Nitrates. The answer is E. Nitrates. Sildenafil is contraindicated in a patient who is already taking nitrates because nitrates alone can cause a decrease in the patient's blood pressure, and sildenafil can also independently cause a decrease in the patient's blood pressure. When taken together, sildenafil and nitrates can cause a potentially very serious drop in the patient's blood pressure that can cause headache, dizziness, weakness, syncope, and any further consequences of those symptoms. Thus, whenever sildenafil is being considered for a patient, their current medication list should be closely evaluated for any other medications that may decrease their blood pressure. Neither fish oil, simvastatin, prednisone, nor aspirin are known to decrease blood pressure and therefore would not be contraindications for administering sildenafil to this patient. You are the nurse taking care of a patient who takes multivitamins, pravastatin, verapamil, warfarin, and prednisone daily, as well as sildenafil as needed for erectile dysfunction. He complains of headaches and dizziness when he takes the sildenafil. What is the most likely reason for these complaints? A. The combined action of sildenafil and prednisone. B. The combined action of sildenafil and pravastatin. C. The combined action of verapamil and sildenafil. D. The combined actions of prednisone and warfarin. E. Side effects of warfarin. The answer is C. The combined action of verapamil and sildenafil. In this patient, he complains of headaches and dizziness that are brought on by taking sildenafil, an erectile dysfunction medication. Common side effects of sildenafil include headaches and lightheadedness, as sildenafil can decrease systemic blood pressure since it is a vasodilator. The risk of experiencing these side effects from sildenafil is increased in patients who take other medications that can decrease blood pressure. Of the other medications that this patient takes, verapamil, a calcium channel blocker, is the most likely medication that is known to decrease blood pressure. The combined actions of sildenafil and verapamil, both to decrease blood pressure, best explain the headaches and dizziness that this patient experiences when taking sildenafil in addition to his daily verapamil. None of the other choices are correct, as the only choice that contained two medications that each individually would decrease blood pressure to explain the patient's symptoms was the choice containing verapamil and sildenafil. You are counseling a patient about the possible side effects of his new blood pressure medication, lisinopril, which is an ACE inhibitor. Which of the following statements would be most appropriate to make when counseling the patient? A. Lisinopril frequently causes blindness as a side effect. B. Lisinopril is associated with an elevated risk of renal cell carcinoma. C. Lisinopril is associated with an elevated risk of myocardial infarction. D. Lisinopril is associated with an elevated risk of stroke. E. You may experience a barky cough when taking lisinopril. The answer is E. You may experience a barky cough when taking lisinopril. This question tests your knowledge of the side effect profile of lisinopril. A very common side effect associated with lisinopril use is a barky cough. Lisinopril, an ACE inhibitor, has an additional effect of inhibiting the degradation of bradykinin, therefore raising circulating levels of bradykinin. Elevated levels of bradykinin result in bronchoconstriction, which can cause the dry, barky cough that some patients taking lisinopril experience. Other side effects of lisinopril include but are not limited to hypotension, headache, dizziness, and syncope. Lisinopril is not known to cause an elevated risk of renal cell carcinoma, myocardial infarction, stroke, or blindness. You are the nurse taking care of a patient in a dermatology practice. The patient is prescribed minocycline, a tetracycline antibiotic, for acne vulgaris. When counseling the patient about the side effects of minocycline, you advise the patient which of the following statements? A. Avoid prolonged sun exposure while taking minocycline. B. Severe headaches can be safely ignored while using minocycline. C. Do not drink apple juice while taking minocycline. D. You should not wear sunblock when outdoors while using minocycline. E. You cannot take acetaminophen while using minocycline. The answer is A. Avoid prolonged sun exposure while taking minocycline. This question tests your knowledge of a common side effect of the tetracycline antibiotic, minocycline. Minocycline is known to cause phototoxicity as a side effect in some patients, which may increase the risk and/or severity of sunburn in patients taking the medication. As such, patients should be counseled to avoid prolonged sun exposure when taking minocycline, and if they must be exposed to the sun for significant periods of time, to wear sunblock and keep their skin covered as much as possible. Other side effects of minocycline include upset stomach, diarrhea, tooth discoloration in young children, and rarely, pseudotumor cerebri, severe headache and visual disturbance due to intracranial hypertension. As such, it would be inappropriate to advise a patient to ignore severe headaches while taking minocycline. Apple juice and acetaminophen are not contraindicated in patients taking minocycline. You are taking care of a patient who requires gentamicin, an aminoglycoside antibiotic, for a complicated urinary tract infection. Which of the following would you be most concerned with when assessing the patient during his gentamicin course? A. Visual acuity. B. Liver function tests. C. Hearing and renal function. D. Hot or cold sensitivity. E. Hair loss. The answer is C. Hearing and renal function. This question tests your knowledge of the significant potential side effects of the aminoglycoside antibiotic, gentamicin. Gentamicin, like most aminoglycosides, carries a risk of ototoxicity and nephrotoxicity. As such, it is very important to assess a patient's hearing function regularly while taking gentamicin, and to follow the patient's BUN or creatinine, to monitor their renal function while taking gentamicin. In addition, gentamicin dosing is often decided upon via close collaboration with the inpatient pharmacist as they take into account the patient's current dosage and the effect that it has had on the patient's renal function to date. Gentamicin is not known to significantly influence liver function, hair loss, visual acuity, or hot or cold sensitivity, and therefore these would not be the most important considerations when assessing a patient who is taking gentamicin. You are the nurse taking care of a patient with intractable back pain. You are about to administer a dose of oxycodone and are describing possible side effects to the patient. Which of the following common side effects should you warn the patient about? A. Constipation. B. Blindness. C. Headache. D. Tinnitus. E. Serotonin syndrome. The answer is A. Constipation. Constipation is a very common side effect associated with use of opioid medications, such as oxycodone, especially in patients who have not been frequently treated with opioids in the past. As such, Patients are often advised ahead of time about the possibility this side effect and may be started concurrently on stool softeners and colonic motility agents, such as senna and ardocusate. Blindness, tinnitus, ringing in the ears, headache, and serotonin syndrome all are not known to be associated with use of opioid medications, like oxycodone. You are the nurse taking care of a patient with severe hip pain that is unresponsive to acetaminophen and NSAIDs. You are prepare a dose of hydromorphone and describe potential side effects to the patient. Which of the following side effects should you warn the patient about? A. Foot pain. B. Pruritus. C. Diarrhea. D. Pharyngitis. E. Hair loss. The answer is B. Pruritus. Pruritus, or itching, is a fairly common side effect of opioid medication use, and hydromorphone, also known as Dilaudid, is a potent opioid. As such, patients should be advised of this potential side effect prior to initiation of therapy, and should be advised to inform the nursing or medical care team if they experience pruritus, as dosing can be adjusted, and/or additional medications may be added to control the itchiness. Neither hair loss, foot pain, pharyngitis, nor diarrhea are side effects known to be associated with opioid use. The answer is E. Diarrhea. Diarrhea is a common side effect associated with antibiotic use, including cefalexin. This diarrhea is typically self-limited and resolves within the first day or two of administration. Sometimes patients are advised to take a probiotic or consume yogurt when starting a new antibiotic if they experienced diarrhea when starting antibiotics in the past. Neither headaches, hair loss, pharyngitis, nor necrotizing skin rash are known common side effects of cefalexin use. You are the nurse in a primary care clinic taking care of a 26-year-old female with a urinary tract infection. You are counseling her about taking her antibiotic, cefalexin. You warn her that a common side effect is which of the following? A. Pharyngitis. B. Headache. C. Hair loss. D. Necrotizing skin rash. E. Diarrhea. The answer is E. Pregnancy. Patients initiating isotretinoin therapy should all be strictly advised to avoid becoming pregnant, and must absolutely not be started on isotretinoin therapy if they are actively pregnant. Isotretinoin is a potent teratogenic agent, and could cause devastating effects to a developing fetus, including but not limited to termination of the pregnancy. Even one dose of isotretinoin can cause major birth defects of the baby's ears, eyes, face, skull, heart, and brain. Any female patient who is going to start isotretinoin therapy must be tested for pregnancy immediately prior to therapy and repeatedly throughout treatment. Make sure you use 2 specific forms of birth control and have regular pregnancy tests while taking this medication. There is no known significant interaction between isotretinoin and NSAID use. Likewise, there is no reason why a patient on isotretinoin must avoid bananas, grains, or juices. You are the nurse in a dermatology clinic taking care of a 22-year-old female with severe nodular acne. She is going to start isotretinoin therapy after this appointment. She should be strictly advised to avoid which of the following? A. Eating grain products. B. Taking NSAIDs. C. Drinking juices. D. Eating bananas. E. Pregnancy. The answer is D. Edema. All of these are possible side effects of calcium channel blockers, but the most common side effect is edema. Calcium channel blockers decrease blood pressure by hindering the influx of calcium into myocardial cells. They may also increase the diameter of blood vessels, which always results in decreased blood pressure. Which of the following is the most common adverse effect of calcium channel blockers? A. AV block. B. Gynecomastia. C. Nausea. D. Edema. The answer is D. Hypertension. Hydrochlorothiazide is a thiazide diuretic, used primarily in the treatment of hypertension and edema. Which of the following conditions can be treated with hydrochlorothiazide? A. Pericarditis. B. Angina. C. Atherosclerosis. D. Hypertension. The answer is B. Angiotensin receptor blocker, ARB. Losartan is an angiotensin receptor blocker, ARB. This class of drugs lowers blood pressure by blocking the conversion of angiotensin 1 to angiotensin 2 and is useful for patients who cannot tolerate ACE, angiotensin-converting enzyme, inhibitors' adverse effects. What class of drug is losartan? A. Loop diuretic. B. Angiotensin receptor blocker, ARB. C. Angiotensin-converting enzyme inhibitor, a CE inhibitor. D. Calcium channel blocker. The answer is D. Calcium channel blocker. Diltiazem is an example of a calcium channel blocker. This class of drugs reduces blood pressure by relaxing smooth muscles in the walls of arteries, leading to vasodilation and decreased peripheral resistance. Diltiazem is an example of what class of cardiovascular medication? A. Angiotensin receptor blocker. B. Beta blocker. C. Potassium-sparing diuretic. D. Calcium channel blocker. The answer is C. Block response to beta-adrenergic stimulation. Beta blockers act by blocking response to beta-adrenergic stimulation. In that way they are beta-adrenergic antagonists, rather than agonists. ACE, angiotensin-converting enzyme, inhibitors, not beta blockers, block the production of angiotensin II, but both act to decrease blood pressure. Beta blockers have nothing to do with beta cells of the pancreatic islets, which secrete insulin. Which of the following describes the mechanism of action of the class of drugs known as beta blockers? A. Beta-2 adrenergic agonists. B. Block the production of angiotensin II. C. Block response to beta-adrenergic stimulation. D. Block beta cell secretion in the pancreas. The answer is C. Beta blockers cannot be stopped abruptly due to risk of severe, even fatal, rebound hypertension. The most critical safety information a patient must know when initiating beta blocker therapy is that they cannot abruptly stop taking their beta blocker, due to the risk of rebound hypertension. A beta blocker would be more likely to cause bradycardia and a depressed effect than anxiety and tachycardia. Beta blockers are not associated with any type of esophagitis and they are not fat-soluble, thus it is not crucial to eat a fatty meal with the drug in order to improve absorption. When educating a patient on a new beta blocker prescription, which of the following safety information is most critical? A. Beta blockers should be eaten with a meal that contains fat to improve absorption. B. Beta blockers may cause anxiety and tachycardia. C. Beta blockers cannot be stopped abruptly due to risk of severe, even fatal, rebound hypertension. D. The patient must stay upright for at least 30 minutes after taking a beta blocker due to risk of esophagitis.
You are the nurse taking care of a patient who is started on trimethoprim, sulfamethoxazole for a urinary tract infection. When counseling the patient about possible side effects, you offer which of the following statements? A. Do not take fish oil while taking trimethoprim, sulfamethoxazole. B. Do not eat bananas while taking trimethoprim, sulfamethoxazole. C. If you notice a skin rash, please call your physician immediately, and if nobody answers, go to the nearest emergency department. D. Avoid contact sports while taking trimethoprim, sulfamethoxazole. E. Do not operative heavy machinery or motor vehicles while taking trimethoprim, sulfamethoxazole. The answer is C. If you notice a skin rash, please call your physician immediately, and if nobody answers, go to the nearest emergency department. A rare, but potentially fatal side effect of trimethoprim, sulfamethoxazole is a severe skin rash called Stevens-Johnson syndrome. This rash results in death of the cells of the epidermal skin layer, and results in their separation from the dermal skin layer. It occurs for a handful of reasons, but most commonly is a hypersensitivity reaction in the skin and mucous membranes to medications, such as trimethoprim, sulfamethoxazole or antiepileptics. It is a true medical emergency. Thus, if any patient taking trimethoprim, sulfamethoxazole experiences a new skin rash, they should call their prescribing physician immediately, and if no one answers, they should proceed to the nearest emergency room. Neither fish oil, nor banana consumption are contraindicated in patients taking trimethoprim, sulfamethoxazole. Trimethoprim, sulfamethoxazole does not typically have any appreciable effects on one's ability to operate heavy machinery, motor vehicles, or play contact sports. Which of the following heart medications is most likely to cause a chronic dry cough? A. Hydrochlorothiazide. B. Nolol. C. Amlodipine. D. Enalapril. E. Losartan. The answer is D. Enalapril is an ACE, angiotensin-converting enzyme, inhibitor. One of the most commonly reported side effects of ACE inhibitor use is a chronic dry cough. This is likely due to the medication's inhibition of kininase 2, a CE, which results in a buildup of kinins in the respiratory tract. None of the other medications listed are associated with persistent cough. What is the antidote for overdose of warfarin? A. Heparin. B. Vitamin K. C. Protamine sulfate. D. IV magnesium. The answer is D. Vitamin K. The proper antidote for overdose of warfarin is vitamin K. Heparin will not reverse the effects of too much warfarin, it would only aggravate the problem. Protamine sulfate is the antidote for overdose of heparin. IV magnesium may be used to antidote digoxin if digobind is unavailable. Which of the following is an adverse effect in the client being treated for hypertension with enalapril? A. Nausea. B. Insomnia. C. Swelling of the tongue. D. Dry cough. The answer is C. Swelling of the tongue. A swelling of the tongue indicates that a client may be allergic to enalapril. Other indicators include rash, hives, itching, difficulty breathing, and tightness in the chest. Which of the following medications is a non-selective beta-adrenoceptor and alpha-adrenergic blocker? A. Carvedilol. B. Lisinopril. C. Amiodarone. D. Clonidine. The answer is A. Carvedilol. Carvedilol is a non-selective beta-adrenoceptor and alpha-adrenergic blocker. Lisinopril is an ACE, angiotensin-converting enzyme, inhibitor. Clonidine is an alpha-adrenergic agonist, and amiodarone is a sodium channel blocker. You are a nurse working on an inpatient medicine floor. One of your patients is advised to discuss starting gamfibrosil, a fibrate medication, after he is discharged. Which of the following best describes the mechanism of action of gamfibrosil? A. Vitamin K-dependent clotting factor synthesis inhibition. B. HMG-CoA reductase inhibition. C. Alpha-adrenergic inhibition. D. Beta-adrenergic inhibition. E. Peroxisome-proliferator activated receptor, PPAR, activation. The answer is E. Peroxisome-proliferator activated receptor, PPAR, activation. This is the accurate mechanism of action for fibrate medications, such as gamfibrosil. Fibrates are commonly used medications used to treat high cholesterol, as well as a number of other metabolic abnormalities in patients. Fibrates have the relatively unique property of lowering LDL, the bad cholesterol, increasing HDL, the good cholesterol, and lowering triglycerides, making them a popular choice when administered either alone, or with statin medications for patients with hypercholesterolemia. HMG-CoA reductase inhibition is the mechanism of action of statins. Vitamin K-dependent clotting factor synthesis inhibition is the mechanism of action of warfarin. Alpha-adrenergic inhibition is the mechanism of action of phenoxybenzimine, among other medications. Beta-adrenergic inhibition is the mechanism of action of propranolol, among other medications. When used with statins, there is a tendency for myositis and rhabdomyolysis. Hence it is advised that patients be advised of this adverse effect and asked to report promptly any muscle pain, weakness or tenderness, particularly if accompanied by fever, malaise or dark urine. Rhabdomyolysis is characterized by plasma creatinine kinase greater than 20,000 IU/L, myoglobinuria and extreme muscular pain, occurs in about 1 in 250,000 patients and is commoner in females, the elderly. Hypothyroidism. If CK is significantly elevated, greater than 5 times the ULN, or if myopathy is suspected, then treatment should be stopped, while the patient is monitored for muscular symptoms and cardiovascular risk. You are the nurse taking care of a patient hospitalized for a deep vein thrombosis. You are reviewing his discharge medications, and counsel him about the benefits and risks associated with apixaban. Which of the following is a major possible adverse effect associated with apixaban? A. Thrombosis. B. Constipation. C. Ischemic stroke. D. Myocardial infarction. E. Bleeding. The answer is E. Bleeding. Apixaban is a novel anticoagulant medication that functions by directly inhibiting factors in the clotting cascade. You can remember this mechanism of action by noting the letters 10A. In apixaban. Apixaban is used with increasing frequency now in the treatment of deep vein thrombosis, pulmonary embolism, and atrial fibrillation. A very serious potential adverse effect of apixaban though is that since it is an anticoagulant agent, it can predispose to serious bleeding events. Furthermore, one of the biggest dangers of apixaban is that there is no readily available antidote for it yet, and as such if a bleeding event occurs, there is no simple way to reverse it, as there is with other anticoagulants like warfarin or heparin. Thrombosis, myocardial infarction, and ischemic stroke are all typically thrombotic, for example clot-related, issues. Apixaban may be used in the treatment of conditions associated with clotting, but is not known to cause clots, as it is an anticoagulant. Apixaban has no known association with bowel movement frequency. You are a nurse taking care of a patient during a rapid response call. The patient is bradycardic and you are asked to administer atropine. Which of the following best describes the mechanism of action of atropine? A. Beta-adrenergic blocker. B. Muscarinic acetylcholine receptor agonist. C. Muscarinic acetylcholine receptor antagonist. D. Alpha-adrenergic blocker. E. Monoaminoxidase inhibitor. The answer is C. Muscarinic acetylcholine receptor antagonist. Atropine is an anticholinergic medication used for a number of reasons, including to treat bradycardia, various nerve agent poisonings, and intraoperatively at times to diminish the amount of saliva generated. Typical anticholinergic medication side effects can be associated with atropine including pupil dilation, urine retention, dry mouth, constipation, and tachycardia. Muscarinic acetylcholine receptor agonist is incorrect as this is the opposite of how atropine works. Beta-adrenergic blocker is incorrect. This class of medications would actually serve to decrease heart rate, which would be highly dangerous in a patient whose reason for intervention is bradycardia. Neither alpha-adrenergic blockade nor monoaminoxidase inhibition describes the mechanism of action of atropine. You are the nurse taking care of a 78-year-old female who is in atrial fibrillation with rapid ventricular response. She is started on metoprolol and diltiazem. Which of the following best describes the mechanism of diltiazem? A. Mu opioid receptor agonist. B. Calcium channel blocker. C. Beta-adrenergic blocker. D. Alpha-adrenergic blocker. E. Mu opioid receptor antagonist. The answer is B. Calcium channel blocker. Diltiazem, which is more specifically a non-dihydropyridine calcium channel blocker, is a commonly given medication that functions to dilate both coronary and peripheral vessels, with a negligible reflex adrenergic response. It also is useful in reducing cardiac contractility, having negative inotropy, chronotropy, and dromatropy characteristics. The other choices are incorrect. Beta-adrenergic blocker is the mechanism of action of metoprolol. Alpha-adrenergic blocker is the mechanism of action of doxycycline. Mu-opioid receptor agonist is the mechanism of action of morphine. Mu-opioid receptor antagonist is the mechanism of action of naloxone. The answer is A. Taper the medication to avoid discontinuation syndrome. Clients taking paroxetine may experience withdrawal and continuation syndrome. To minimize symptoms, taper the medication over a period of 3 or more weeks. A client has been taking daily doses of paroxetine for 6 months and has asked for an information with the nurse about going off the medication. What should the nurse emphasize in the information session? A. Taper the medication to avoid discontinuation syndrome. B. Advise the patient of probable weight gain after going off the medication. C. Stop taking the medication immediately. Increase physical activity level for 2-3 weeks to counteract side effects. D. Urge the client to continue taking the medication until he consults a psychotherapist. What type of antidepressant is fluoxetine? A. Monoamine. Oxidase inhibitors, MAOI. B. Norepinephrine reuptake inhibitor, NRI. C. Selective serotonin reuptake inhibitor, SSRI. D. Tetracyclic antidepressant. The answer is C. Selective serotonin reuptake inhibitor, SSRI. Fluoxetine is an example of a selective serotonin reuptake inhibitor, SSRI. SSRIs limit the amount of serotonin that the presynaptic cell that secreted it can reuptake. This increases the time and amount that serotonin is in the synaptic cleft and bound to postsynaptic receptors, leading to antidepressant properties. The other drugs are all antidepressants, but are sold under other names. What drug class is clomipramine? A. Serotonin modulator and stimulator, SMS. B. Selective serotonin reuptake inhibitor, SSRI. C. Monoamine oxidase inhibitor, MAOI. D. Tricyclic antidepressant. The answer is D. Tricyclic antidepressant. Clomipramine is a tricyclic antidepressant. Drugs in this class function primarily by blocking serotonin and norepinephrine transporters, resulting in an increase in the levels of these neurotransmitters in the synapse, and thus an increase in their effects due to staying bound to postsynaptic receptors for longer. What class of drug is trazodone? A. Tricyclic antidepressant. B. Tetracyclic antidepressant. C. Serotonin antagonist and reuptake inhibitor, SARI. D. Norepinephrine reuptake inhibitor, NRI. The answer is C. Serotonin antagonist and reuptake inhibitor, SARI. Trazodone is a serotonin antagonist and reuptake inhibitor. These drugs work by increasing the release and inhibiting the reuptake of serotonin in the synaptic space, thus increasing the effect of serotonin. Aripiprazole is what class of drug? A. Selective serotonin reuptake inhibitor, SSRI. B. Atypical antipsychotic. C. Serotonin norepinephrine reuptake inhibitor, SNRI. D. Serotonin modulator and stimulator, SMS. The answer is B. Atypical antipsychotic. Aripiprazole is an atypical antipsychotic. It acts as a partial dopamine agonist and an agonist to multiple 5-HT, serotonin, receptors. What class of drug is quetiapine? A. Serotonin antagonist and reuptake inhibitor, SARI. B. Norepinephrine reuptake inhibitor. C. Tricyclic antidepressant. D. Atypical antipsychotic. The answer is D. Atypical antipsychotic. Quetiapine is classified as an atypical antipsychotic. Quetiapine is a powerful antihistamine and has pharmacological action at many receptor types. It is a serotonin, dopamine, and adrenergic antagonist. Which of the following antidepressants is also used for smoking cessation? A. Bupropion. B. Venlafaxine. C. Amitriptyline. D. Buspirone. The answer is A. Bupropion. Bupropion is an antidepressant used for smoking cessation. None of the other medications listed are used for smoking cessation. sertraline, paroxetine, and citalopram, are all classified as what type of antidepressant? A. Selective serotonin reuptake inhibitors, SSRIs. B. Serotonin modulator and stimulators, SMSs. C. Monoaminoxidase inhibitors, MAOIs. D. Serotonin norepinephrine reuptake inhibitors, SNRIs. The answer is A. Selective serotonin reuptake inhibitors, SSRIs. Sertraline, paroxetine, and citalopram are all selective serotonin reuptake inhibitors, SSRIs. This class of drug works by blocking serotonin reuptake in the synapse, thus increasing postsynaptic serotonin stimulation. They are one of the most widely used class of antidepressants in the United States and many parts of the world. Zolpidem belongs in what drug class? A. Non-benzodiazepine hypnotic. B. Benzodiazepine. C. Selective serotonin reuptake inhibitor, SSRI. D. Orexin antagonist. The answer is non-benzodiazepine hypnotic. Zolpidem is a short-acting non-benzodiazepine hypnotic. Its actions are similar to benzodiazepine drugs in that it stimulates GABA receptors at the same location as benzodiazepines. It is used in insomnia for initiating sleep, though its short half-life, 3 hours, means it is not generally considered effective for maintaining sleep. All of the following are common anticonvulsants except A. Carbamazepine. B. Lamotrigine. C. Valproate. D. Risperidone. The answer is D. Risperidone. All of the answers given are common anticonvulsant medications except risperidone, which is a second-generation atypical antipsychotic used in schizophrenia and bipolar disorder. Lamotrigine carries a black box warning about what side effect? A. DRESS syndrome, drug reaction, rash with eosinophilia and systemic symptoms. B. Stevens-Johnson syndrome. C. Aseptic meningitis. D. All of these. The answer is D. All of these. Lamotrigine carries a black box warning about the following side effects: Stevens-Johnson syndrome, toxic epidermal necrolysis, DRESS syndrome, drug reaction, rash with eosinophilia and systemic symptoms, aseptic meningitis. Phenelzin is what class of drug? A. Monominoxidase inhibitor, MAOI. B. Tricyclic antidepressant. C. Alpha-adrenergic agonist. D. Narcotic. The answer is A. Monominoxidase inhibitor, MAOI. Phenelzin is a monominoxidase inhibitor, MAOI. Drugs in this class work by inhibition of monominoxidase enzymes, the enzymes responsible for the breakdown of serotonin, dopamine, and adrenaline. What class of drugs is diazepam? A. Non-benzodiazepine sedative. B. Benzodiazepine. C. Methaqualone analog. D. Barbiturate. The answer is B. Benzodiazepine. Diazepam is a benzodiazepine. This class of drugs works by potentiating the effects of GABA, our primary inhibitory neurotransmitter, at the GABA-A receptor. Bromocriptine belongs to what class of drug? A. Peripheral dopamine decarboxylase inhibitor. B. Anxiolytic. C. Anticholinergic. D. Dopamine agonist. The answer is D. Dopamine agonist. Bromocriptine is a dopamine agonist used in the treatment for Parkinson's disease, pituitary tumors, and type 2 diabetes. A patient taking haloperidol complains of abnormal, unintentional movements of his tongue and face. The nurse knows that the patient is experiencing which of the following side effects of haloperidol? A. Convulsions and seizures. B. Neuroleptic malignant syndrome. C. Increased anxiety. D. Tardive dyskinesia. E. Dizziness and weakness. The answer is D. Tardive dyskinesia. All of the listed options are side effects of haloperidol, but tardive dyskinesia is the only one that manifests with involuntary, dyskinetic movements in their face, lips, tongue, trunk, and extremities. Tardive dyskinesia more frequently occurs among elderly female patients taking long-term dopamine antagonist medications. Dizziness, weakness, convulsions, seizures, and anxiety are also side effects of haloperidol. Neuroleptic malignant syndrome presents with fever and high, unstable blood pressure, muscle cramps and tremors, altered mental status, such as delirium, agitation, or a coma. You are the nurse taking care of a patient who is experiencing a panic attack. You are instructed to give the patient a dose of lorazepam. Which of the drug classes below describes lorazepam? A. Barbiturate. B. Alpha blocker. C. Beta blocker. D. Benzodiazepine. E. Amphetamine. The answer is D. Benzodiazepine. The correct answer is benzodiazepine, as lorazepam, also known as Ativan, is a benzodiazepine drug. Benzodiazepines act by increasing the efficacy of the neurotransmitter, GABA, when it acts upon its particular receptors. They have potent anti-anxiety properties, among other properties, and are frequently given during the initial phase of a panic attack to calm the patient. On the other hand, the other choices are incorrect. Phenobarbital is an example of a barbiturate. Propranolol is an example of a beta blocker. Tamsulosin is an example of an alpha blocker. Methamphetamine is an example of an amphetamine. Metoclopramide is used in the treatment for which of the following conditions? A. Ulcer disease. B. Tuberculosis. C. Chronic bronchitis. D. Vomiting after chemotherapy. The answer is D. Vomiting after chemotherapy. Metoclopramide is an antiemetic and gastroprokinetic agent commonly used to treat nausea and vomiting, to facilitate gastric emptying in people with gastroparesis, and as a treatment for the gastric stasis often associated with migraine headaches. Fluorouracil is used to treat which of the following conditions? A. Myasthenia gravis. B. Rheumatoid arthritis. C. Colorectal, breast, and ovarian cancer. D. Ulcerative colitis. The answer is C. Colorectal, breast, and ovarian cancer. 5-fluorouracil is a fluoropyrimidine analog which inhibits translation, synthesis, and function of RNA and DNA, thus slowing down cellular metabolism. It is used in treatment of colorectal, breast, and ovarian cancer, in addition to cancers of the GI and head and neck. Which of the following laboratory values would indicate toxicity in the client taking acetaminophen daily? A. Sodium level of 140 milliequivalent per liter. B. Direct bilirubin level of 2 mg per deciliter. C. Prothrombin time of 12 seconds. D. Platelet count of 400,000 per cubic millimeter. The answer is B. Direct bilirubin level of 2 mg per deciliter. A direct bilirubin level of 2 mg per deciliter or greater indicates acetaminophen toxicity. The purpose of misoprostol in a client who chronically uses non-steroidal anti-inflammatory drugs, NSAIDs, is A. Decrease in serum phosphorus level. B. Relief of epigastric pain. C. Reduction of steatorrhea. D. Increased white blood cell count. The answer is B. Relief of epigastric pain. Misoprostol is used for the prevention of non-steroidal anti-inflammatory drug, NSAID, induced gastric ulcers. Taking this drug will prevent gastric ulcers and relieve epigastric pain. Clinically, abdomen is divided into 9 zones. Epigastrium is the part of the abdomen immediately over the stomach. It is located between the costal margins and the subcostal plane. The epigastric, above stomach, region contains the majority of the stomach, part of the liver, part of the pancreas, part of the duodenum, part of the spleen, and the adrenal glands. During breathing, the diaphragm contracts and flattens, displacing the viscera and producing an outward movement of the upper abdominal wall, epigastric region. It is a convergence of the diaphragm and the rectus abdominis, so that when both sets of muscles, rectus abdominis, tense, the epigastrium pushes forward. It is also the spot where the Heimlich maneuver is able to produce a rapid and forceful exhalation of breath.
Which of the following analgesics is available in lollipop form? A. Hydrocodone. B. Oxycodone. C. Tramadol. D. Fentanyl. The answer is D. Fentanyl. Fentanyl citrate comes in solid form on a stick, often referred to as a fentanyl lollipop. This form is 8,100 times more potent than morphine and intended for use by cancer patients and patients that have become tolerant to opioids. Celecoxib is what class of drug? A. Muscle relaxant. B. Narcotic. C. Non-steroidal anti-inflammatory drug, NSAID. D. Corticosteroid. The answer is C. Non-steroidal anti-inflammatory drug, NSAID. Celecoxib is a non-steroidal anti-inflammatory drug, NSAID. These drugs work by inhibiting cyclooxygenase 1, COX-1, and cyclooxygenase 2, COX-2, which reduces the synthesis of pro-inflammatory prostaglandins and thromboxane. Which of the following is an antidote to opioid overdose? A. Naloxone. B. Flumazenol. C. Inositolcysteine. D. Glucagon. The answer is A. Naloxone. Naloxone antidotes opioid overdose by competitively binding to mu-opioid receptors. Flumazenol is an antidote to benzodiazepines. Glucagon is an antidote for beta-blocker overdose. Inositolcysteine is an antidote for acetaminophen. Which of the following over-the-counter analgesics is one of the most common causes of liver failure in the United States? A. Acetaminophen. B. Ibuprofen. C. Aspirin. D. Naproxen. The answer is A. Acetaminophen. Acetaminophen in doses over 3,000 mg per day can result in significant liver damage or liver failure. From 1998 to 2003, acetaminophen was the leading cause of acute liver failure in the United States. According to a population-based report in 2007, there are an estimated 1,600 cases of acute liver failure in the United States every year, with acetaminophen being the most common etiology. Levodopa is not generally given alone due to what side effects? A. Nausea, vomiting, and anorexia. B. Delirium. C. Heart palpitations. D. Tremor. The answer is A. Nausea, vomiting, and anorexia. Levodopa, L-Dopa, a common treatment for Parkinson's disease, is generally given in combination with carbidopa or another peripheral dopa decarboxylase inhibitor. This is because levodopa alone will stimulate dopamine receptors in the GI tract and the chemotrigger receptor zone, CTZ, in the brain, resulting in nausea, vomiting and anorexia. A peripheral dopa decarboxylase inhibitor prevents levodopa from being prematurely converted into dopamine in the adrenal glands or other peripheral tissues. How does adalimumab function to reduce inflammation in rheumatoid arthritis? A. Cyclooxygenase 1, COX-1, and cyclooxygenase 2, COX-2, inhibitor. B. Tumor necrosis factor alpha inhibitor. C. Monoclonal antibody. D. More than one of these. The answer is D. More than one of these. Adalimumab is a tumor necrosis factor alpha, TNF-alpha, inhibitor. This class of drugs suppresses response to TNF-alpha, a potent pro-inflammatory cytokine. Inhibition of folic acid metabolism is the method of action of methotrexate. Reversible inhibition of COX-1 and COX-2 is the mechanism of non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen. Rheumatoid arthritis drugs such as rituximab, and almost all drugs that end in mab, including adalimumab, function as monoclonal antibodies. Which of the following analgesic medications should be used with caution in patients with hepatic disease? A. Acetaminophen. B. Ibuprofen. C. Ketorolac. D. Meloxicam. E. Naproxen. The answer is A. Acetaminophen. Acetaminophen, also known as Tylenol, is initially metabolized into a hepatotoxic intermediate. It transiently becomes a reactive oxygen species, which can cause liver hepatotoxicity. As such, in patients who already have pre-existing liver disease who are already more prone to liver injury from substances and diseases that affect the liver, it is prudent to avoid medications like acetaminophen that have a known potential to cause liver damage. Meloxicam, ibuprofen, naproxen, and ketorolac are all examples of NSAIDs. These medications have the potential to cause renal damage or gastrointestinal damage if used in excess, but do not have the known hepatotoxic properties that acetaminophen does. You are the nurse taking care of a patient who is started on a 2-week course of oral prednisone. Which of the following is a known side effect of oral steroids? A. Hypotension. B. Hyponatremia. C. Insomnia. D. Decreased appetite. E. Hyperkalemia. The answer is C. Insomnia. The correct answer is insomnia, as steroids are known to increase patients' vigilance and energy levels, thereby frequently making it difficult for patients to fall asleep and/or stay asleep while taking their steroid medication. The other choices are incorrect. Decreased appetite is not a side effect of taking steroid medications. Patients on steroids often have increased appetite. Hyponatremia and hyperkalemia both are not side effects of taking steroid medications. Hypernatremia and hypokalemia are more common side effects of steroids. Hypertension, rather than hypotension, is a known side effect of steroid use. You are the nurse taking care of a patient with severe lower back pain. He is being treated with oxycodone and hydromorphone. Which of the following analgesic medications produces dilated pupils? A. Mepridine. B. Morphine. C. Hydromorphone. D. Acetaminophen. E. Oxycodone. The answer is A. Mepridine. Mepridine, a potent opiate analgesic, also known as Demerol, is one of the only opioids that produces dilated pupils, rather than constricted, pinpoint pupils. A way to remember this is to remember the phrase, Demerol dilates. The other choices are incorrect. Acetaminophen has no known effect on pupil size. Morphine, oxycodone, and hydromorphone, all opiate analgesics, are known to constrict the pupils. Demerol dilates. Demerol dilates. Demerol dilates. You are the nurse taking care of a patient who is hospitalized for severe lower back pain. The patient also has a medical history significant for multiple gastrointestinal bleeds and peptic ulcer disease. Which of the following medications should be used with extreme caution in this patient given his medical history? A. Oxycodone. B. Morphine. C. Hydromorphone. D. NSAIDs. E. Acetaminophen. The answer is D. NSAIDs. This is the correct answer because NSAIDs are known to be irritants of the gastrointestinal tract, and prolonged and/or extensive use of NSAIDs can increase the risk of developing gastrointestinal ulcers, as well as consequent gastrointestinal bleeds in the setting of ulcers. NSAIDs reduce the production of the hormone prostaglandin. One of the things prostaglandin does is increase the production of gastric, stomach, mucus and substances that neutralize stomach acid. If there is too little prostaglandin, the stomach lining becomes more susceptible to damage from stomach acid. The other choices are incorrect. Acetaminophen is not known to increase the risk of gastrointestinal bleeding or peptic ulcer formation. Morphine, oxycodone, and hydromorphone are all opiate analgesics and are not known to increase the risk of gastrointestinal bleeding or peptic ulcer formation. The home health nurse reviews the types of insulin prescribed to the client diagnosed with diabetes mellitus type 1. Which of the following insulins experiences peak action between 6-12 hours? A. Glargine. B. Lispro. C. Regular. D. Isophene, NPH. E. Aspart. The answer is D. Isophene, NPH. It is essential for the nurse to know the onset, peak, and duration of actions for all types of insulin. Rapid-acting insulins Lispro and Aspart have an onset between 10 to 30 minutes, peak between 30 minutes to 3 hours, and have a duration of 3 to 6 hours. Regular insulin has an onset between 30 to 60 minutes, peaks between 1 to 5 hours, and lasts 6 to 10 hours. Intermediate-acting insulin zysofene, INPH, has an onset between 1 to 2 hours, peaks between 6 to 12 hours, and lasts 16 to 24 hours. Very long-acting insulin glargine has an onset between 3 to 4 hours, does not peak because it works continuously, and lasts 24 hours. The answer is C. Tiotropium. Albuterol, terbutaline, and somaterol are all beta-2 adrenergic agonists. Beta-2 adrenergic agonists are a drug class used as mainstay treatments for respiratory diseases such as bronchial asthma and chronic obstructive pulmonary disease, COPD. They replicate the functions of catecholamines such as epinephrine, norepinephrine, and dopamine in producing different autonomic responses within the body. Beta-2 adrenergic agonist. They stimulate beta-2 adrenergic receptors, causing smooth muscle relaxation in the bronchial passages. Tiotropium, trade name Spiriva, is an anticholinergic bronchodilator. All of the following are examples of adrenergic agonists except dash. A. Terbutaline. B. Somaterol. C. Tiotropium. D. Albuterol. Which of the following is an example of an inhaled steroid used in the treatment of asthma? A. Somaterol. B. Fluticasone. C. Ipratropium. D. Tiotropium. The answer is B. Fluticasone. Fluticasone, trade name Flovent, is a synthetic glucocorticoid used in the treatment of asthma and allergic rhinitis. Tiotropium, trade name Spiriva, and ipratropium, trade name Atrovent, are both anticholinergics, and somaterol, trade name Serivent, is a beta-2 adrenergic receptor agonist. What class of drug is montelukast? A. Long-acting beta-2 agonist, LABA. B. Anticholinergic bronchodilator. C. Leukotriene inhibitor. D. Corticosteroid. The answer is C. Leukotriene inhibitor. Montelukast is a leukotriene inhibitor. It acts by antagonism of the leukotriene receptor sites in bronchial wall smooth muscle to prevent wheezing, chest tightness, and coughing caused by asthma, and to treat other respiratory issues to promote proper ventilation. Each of the following antibiotics works by inhibition of the 50S subunit of bacterial ribosomes except ASH. A. Macrolides. B. Clindamycin. C. Streptogramin. D. Tetracyclines. The answer is D. Tetracyclines. Macrolides, streptogramins, and clindamycin all work by inhibition of the 50S subunit of bacterial ribosomes. Tetracyclines have a similar mechanism of action, but instead affect the 30S unit of bacterial ribosomes. Polymyxin antibiotics target what part of the bacterial cellular anatomy? A. Nucleic acids. B. Ribosomes. C. Cell wall. D. Cell membrane. The answer is D. Cell membrane. Polymyxin antibiotics function by interfering with phospholipid function in bacterial cell membranes. After binding to lipopolysaccharide, LPS, in the outer membrane, polymyxin's hydrophobic tail causes damage to both the inner and outer membranes of gram-negative bacteria. What is the mechanism of action of amoxicillin? A. Interference with the 50S subunit of bacterial ribosomes. B. Inhibition of bacterial cell wall synthesis. C. Interference with the 30S subunit of bacterial ribosomes. D. Suppression of folate synthesis. The answer is B. Inhibition of bacterial cell wall synthesis. Amoxicillin inhibits bacterial cell wall synthesis by interfering with the formation of cross-links between peptidoglycan polymer chains. Which of the following class of antibiotics is associated with ototoxicity and hearing loss? A. Quinolones. B. Beta-lactam antibiotics. C. Aminoglycosides. D. Glycopeptides. The answer is C. Aminoglycosides. Aminoglycoside antibiotics such as streptomycin and gentamicin have been associated with vestibular toxicity and hearing loss. Aminoglycosides remain in inner ear fluids longer than serum and can have a latent ototoxic effect, causing hearing loss even after the antibiotic has been discontinued. None of the other antibiotics listed are associated with ototoxicity. Ciprofloxacin belongs to what class of antibiotic? A. Tetracyclines. B. Beta-lactams. C. Fluoroquinolones. D. Macrolides. The answer is C. Fluoroquinolones. Ciprofloxacin belongs to the fluoroquinolone class of antibiotics. Other antibiotics in this class include norfloxacin, levofloxacin, and natafloxacin. What is rifampin's mechanism of action? A. Disruption of cell membranes. B. Inhibition of DNA gyrase. C. Inhibition of RNA polymerase. D. Inhibition of the 30S subunit of bacterial ribosomes. The answer is C. Inhibition of RNA polymerase. Rifampin inhibits bacterial RNA synthesis by inhibiting RNA polymerase. This prevents the transcription of proteins within the bacterial cell, leading to cell death.